Gonna go live. All right. Good morning, good afternoon, good evening, depending on where or when you are watching this Facebook Live. This is the voice and the face of Dr. Tolu Olabintan, CEO, founder of Living Spring Family Medical Center here in the good city, great city of Mansfield, Texas. We're here today doing another live, all in the purpose of helping you, our viewers, live long and well, because we believe that the quality of life is just as important as the quantity of life. And I'm excited to be having on the show Dr. Raman Ashta. Thank you, Dr. Ashta, for being here. I know you were busy. I appreciate you taking the time to talk with us. How are you?
I'm great. Thank you, Dr. Olabintan. I appreciate you having me on your platform. It's a great effort by you to spread awareness about health topics. It takes time and effort and commitment, and I admire you for that.
Thank you so much. I appreciate that feedback. That's encouraging. Thank you. All right. Now I know I mentioned your name, but for those who are watching, because we're doing the topic, I'm told I have PCOS. What does that mean? Please introduce yourself. Who are you and what do you do?
So I'm Dr. Raman Ashta. I'm a board certified family physician. I practice primary care and obesity medicine. My practice is NASA Primary Care in Melbourne, Florida, and I see patients ages 13 and up in my practice and help
Awesome.
them with primary care needs and their weight issues as well.
Awesome, awesome. Why do you do what you do? What led you down this path? Family medicine and then obesity medicine.
Yeah. So as a fellow family doc, I'm sure you can resonate that it is a very gratifying field. It's often underappreciated, but it's so vital to the health of patients and to the health of community. For me, the most gratifying part is the long-term relationships and the trust that I build with my patients. I'm sure you might feel the same, and you feel like, or I feel like I can make a meaningful impact in their
Impact.
life and their health. And as far as obesity medicine and metabolic health goes, it was initially driven by selfish reasons. For as long as I can remember, I saw my grandfather inject himself with insulin 3 times a day. This was,
Mm,
as long as 40 years ago.
wow.
And there were, the things like glucometer or disposable syringes or pens were not a thing in those days. They had to boil the glass syringe and the stainless steel needle and draw it up, and
Ooh.
it was this whole thing that his life revolved around. And over time, other family members had issues with diabetes, and then I was pregnant with my second child, and lo and behold, I have gestational diabetes. I'm like, what? Like,
Mm,
I'm a doctor. I know how these things work. Like, I shouldn't have this. So
right.
that led me to take a deep dive into metabolic health and insulin resistance and how to control it, overcome it. It helped me, and I use it to help my patients.
I love that you have an experience that you can share with your patients because it resonates more when you can relate to some of their struggles. So um,
Definitely.
you're empowered to empower others. So this is good. This is good. So we're gonna jump right to it. PCOS. I have patients who come in. I'm sure you get all the time who come in. Oh, somebody told me
Mhm.
before I have PCOS. But for those who are watching, what is PCOS? What does that mean?
So PCOS is abbreviation for polycystic ovary syndrome. It's a complex metabolic or hormonal disease complex. It is not one thing, and it's not even clear to date what exactly is the
Yeah.
main issue. There are different schools of thought. One school of thought is it happens because of insulin resistance. The other school of thought is the hypothalamus driven hormone imbalance, which can, in turn cause insulin resistance. So, to the main definition, and there's controversy about that too, but most commonly used criteria is the Rotterdam criteria. So for you to have PCOS, you have to have 2 out of 3 symptoms or issues. Number one is irregular periods.
Hmm.
It doesn't mean that your bleeding is heavy, but the frequency of the periods. If they come every 28 to 35 days, then they are considered regular. But if they're
Right.
like 60 days apart or 90 days apart, or some patients say, oh, I just get 2 periods a year,
Yeah.
this is great. So that's number one
Mm.
criteria. Number two would be the the signs or the lab value of androgen excess or excess of male hormone. So the signs like facial hair or acne or loss of scalp hair, or in the blood work, if you see that the male hormones are high, that qualifies as criteria number two. And number three is when you do an ultrasound of the ovaries, there are multiple follicles. So if you have two out of three, you qualify as having PCOS.
Thank you for that definition. And you already answered the next question. How is PCOS diagnosed? And I wanted to speak to the fact that this is sometimes a very uh, overwhelming diagnosis or frustrating. I call it, the word is frustrating. Patients come in, they're frustrated. So what caused it? And we'll talk about that next. Like, what are causes? Because patients ask, like, what did I do? Is it because I used birth control before? Is it because I don't exercise? Like, what causes it? What would you say to that someone who's wondering, like, what did I do, doc? How come this is something I have to struggle with?
I would say that there's nothing that a patient did that caused it. Because honestly, there's no clear cut answer to that in the scientific community, even. But it is a hormonal imbalance. You did not cause it, it happens like many other disease processes. Sometimes it affects you more if there's family history of insulin resistance or PCOS, that is more likely to affect you. But there are things that we will talk about that you could do to help it. Taking birth control pills did not cause it. Um, some people would say that, oh, I was taking birth control pills, and when I stopped, my periods became irregular. And that was because the pills were regulating your periods. And now that you're in the natural state, they are, you know, the PCOS is making itself known.
Known.
Yeah.
Now, you mentioned the diagnosis or the criteria for PCOS, but what are the typical symptoms of PCOS aside from the irregular cycles? Like, are you seeing patients? Um, One I tend to see is issues with weight.
Mm-hmm.
But what are other ways that PCOS can present itself in patients or symptoms?
So the number one symptom is irregular periods, and then, as you said, 80% of patients have excess weight. Then the symptoms are facial hair, the hair that mimic male pattern hair. So hair in the midline of the body, the chin. Some women may have hair on the chest, darker hair in the below the navel, and then thick hair on the insides of the thighs.
Okay.
So that is a way to see if it is the excess male hormone type pattern. The other thing is hair loss on the scalp. So hair are in all the places you don't want them. They're not in the place that
Where you want them.
where you want them.
Frustrating.
Yeah.
Frustrating.
And then acne, which are very, very hard to treat acne. Some women may be on, Accutane for that. So those would be main symptoms. Other symptoms, or actually what we see on exam, is the markers of insulin resistance, like acanthosis nigricans, this velvety dark rash that could be on the neck, on the elbows, on the knuckles, as well as multiple skin tags. That could be one of the symptoms.
Thank you. Thank you. Very, very, very good response. Very good for people to know what are potential
Mhm.
symptoms of PCOS. Now, one of the biggest concerns with PCOS is in relation to fertility. For someone who's here, who's, heart's beating real fast, like, oh my goodness, does that mean I have PCOS? What are my chances as far as getting pregnant? Like, does that mean that fertility will be an issue? What would you say to that, Doc?
I would say that PCOS is a very common cause of infertility, but of all the causes of infertility, this is probably a good one to have because it's treatable. So what happens in PCOS is the ovaries are not releasing egg once a month on time. The eggs are kind of, so that's why when you look at the ovaries on an ultrasound, there are multiple follicles. The eggs are waiting to be released, but they're all in there. So you have eggs. It's good. But naturally, you may not be able to get pregnant because to make an embryo, there are two parts required. If the egg is not there, it's not going to happen. The good news is that there are so many great treatments, and we'll touch on some of them. that it is something that's very manageable.
Yes, it is. So there's hope for those
There
who
is
watch
hope,
it.
definitely. Yes.
There is hope. If there's anyone to have as far as cause of infertility, this is one in that sense. All right. Now there I have patients who come to me and say, you know what, doc, I get it. This is the diagnosis. What can I do to perhaps the phrase is minimize the risk of this getting worse, or what are things that I can do to avoid so that I don't get worsening of PCOS or I don't get PCOS? What would you say to that?
So first, we have to understand what it is that they are struggling with. If they say, "Oh, it can cause infertility, but I don't care. I don't, I'm not looking to have children. I don't care if I have 2 periods a year. This is great. You know, it's fine."
Yay.
But the thing is, we need to look for what it can cause down the road. If you don't have periods regularly, the endometrial lining keeps on building up. So that you end up having a long period, maybe over 6 weeks or 2 months at some point. Or you may have endometrial hyperplasia, it increases the risk of endometrial cancer. So it's important to induce bleeding every um, couple months at
Come
least.
on.
So that's one. And then the insulin resistance that's associated with PCOS that can cause prediabetes, it can cause diabetes. You gain weight, that can cause high cholesterol. You can develop fatty liver. And 1 in 4 people in US have fatty liver now. And that's not a benign thing. In over time it can cause cirrhosis. So, if we let things continue as is, it can have pretty significant health risks in terms of heart disease and stroke, and overweight and all the things that come with excess weight. So to help improve that, lifestyle changes are number one. Make sure you get some exercise. Make sure you get some strength training, because building muscle will help with insulin resistance, and even more important is your dietary changes. We all feel like we eat healthy, but if you do, and I felt like that when I had gestational diabetes. But when you do a deep dive, a lot of our foods that are touted as healthy are very rich in processed carbohydrates. So if we cut out or cut down on processed carbohydrates, even lose 5% of body weight in somebody who is overweight, that can impact your metabolic health and your quality of life greatly.
Awesome. There are a lot of things you highlighted, but I wanted to pick at some of them. One, it is the symptom of PCOS that affects you or affects your quality of life. That typically is what precipitates or what makes you as a physician say, okay, let's take care of this.
Mm-hmm.
So one of the things I always like to encourage patients to do is when you go see your doctor, have certain questions,
Mm-hmm.
have your questions listed, and then um, and explain it in a way that affects your quality of life, meaning
Right.
what's important to you. So for you, being able to have a child is important, and so you want to address that. You don't mind the periods being few and far between, okay, but we want to allow breakthrough bleeding so we minimize the risk of cancer of the lining of your uterus, your womb. But the lifestyle changes I wanted to also re-emphasize. I have patients, we talk about avoiding inflammatory foods. What are those, right? Those are the processed foods you talked about. So diet is really, really linked. I did not ask her to say this. And so when I emphasize this, it's like I'm nagging, but it's important. Avoid foods that are processed. The more natural a food is, the better it is for you. Exercising, strength training, you mentioned, especially to build muscles, because that helps reduce the risk of insulin resistance, which is the pathway to diabetes. I love it, doc. This is really, really good. So thank you for answering our questions. I have another question though. So someone who's watching now, who's saying, "Oh my goodness, I feel overwhelmed, doc. It sounds like a lot of information." What would you say are like maybe three top tips for anyone who may have this diagnosis, and for them to prioritize, even all in the hopes of living long and well? What would you say to that person who's watching?
I would say to them, number one, it's great if you already know that you have it, because first step to manage anything is to recognize that you have it. And if you have that knowledge, your doctor made that diagnosis, or you feel with your symptoms you have it, then that's a great step one, because there is a lot of help available for PCOS. There are medications that can help regulate your insulin, that can help regulate your periods, that can manage symptoms of acne or facial hair. And then there are lifestyle changes that you can make that you're in control of, that can help prevent these long term complications. So, number one is it's great to acknowledge that you have it.
True.
Number two is know your numbers, know where you're at. Go to your primary care doctor, get your blood sugar, your cholesterol, your liver enzymes checked to see, take an inventory of where you're at and how much you need to start with. Like if losing some weight will help, or you need to add medications, or there are things that you need to monitor every
Mm.
6 months to a year frequently to make sure they're not getting worse. But
Awesome.
PCOS is like it's a complex issue that intimidates a lot of patients, but it is manageable. There is a lot of different lifestyle and medication help available for that.
Awesome. This is so I want us to, I want you to be encouraged, for you who is watching. The diagnosis is not as intimidating as it's not as it appears to be. There's
Mhm.
hope. You know what your diagnosis is, and so you're armed with information to help improve your own quality of life, right? Knowledge is power. So be encouraged. There's hope. There are options. And of course, everything we talked about today, medical suggestions, is very, very important with you, for you to schedule an appointment with your primary care doctor, and come up with a personalized plan for you. But please don't give up on yourself. Even with this diagnosis, there's hope. There's hope. Thank you so much, Doc. This is good.
Thank you for having me. I enjoyed our conversation.
Yeah, me too. Me too. All right. So for those who are watching who are like, I like this Dr. Ashta, and I'm not too far from the Florida area. Where can people
Yay.
connect with you to have
Yeah.
you come as a
Sure.
speaker, to have you come to have connect with you as a physician? Where can people find you?
Of course. So I'm located in Melbourne, Florida. My practice is NASA Primary Care. So you can find me on our website www.nasaprimarycare.com. And if you're on Space Coast of Florida and you need a primary care doctor, come find me.
That's right.
And if I am on Facebook at Raman Ashta MD. Facebook page, and on Instagram by the same name, Raman Ashta MD. And if you would like to follow me for little tidbits and health, information, I'll be glad to have you. Thank you.
You are welcome. Awesome, awesome. And at the end of this live, that information will be posted in the comments section so people can connect with you. Once again, Dr. Rahman, thank you so much for coming. I'm honored to have you here.
Same here. Thank you, Dr. Olabintan.
All right, you're welcome. Thank you all for watching. Be sure to share. Remember, sharing is caring. And if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician who helps patients live long and well, I am she. Have a good one. Bye.